A panic attack is a sudden episode of intense fear that triggers severe physical reactions when there's no real danger present. Imagine going about your day when suddenly your heart races, breathing becomes difficult, and overwhelming sense of dread comes to you. These attacks typically peak within minutes, making you feel like you're losing control, having a heart attack, or even dying. Although they can be terrifying, panic attacks aren't physically dangerous. They usually last between a few minutes to half an hour, though emotional effects may linger longer. While many people might experience one or two panic attacks during stressful periods without further episodes, recurrent attacks could indicate panic disorder. Panic disorder is characterized by frequent, unexpected panic attacks, along with persistent fear of future attacks and changes in behavior to avoid situations that might trigger one. What's interesting here is that panic attacks are surprisingly common, affecting millions of people worldwide. Studies show that around 11% of people will experience at least one panic attack in their lifetime, though not all go on to develop panic disorder. In the United States alone, about 2 to 3% of adults are diagnosed with panic disorder each year, with women being twice as likely as men to be affected. Types of panic attacks. Panic attacks generally fall into two main categories: expected and unexpected. Unexpected panic attacks occur without an obvious trigger, seemingly out of the blue, striking when you're engaged in non-threatening activities like watching TV or sleeping. These unpredictable attacks are the hallmark of panic disorder and particularly distressing because they happen without warning. Expected panic attacks are associated with specific triggers or situations. These might occur when you're exposed to something you fear, like flying or public speaking, or in situations where you've previously had attacks. For example, if you once had a panic attack while driving, you might experience another when approaching a highway. Symptoms of panic attacks. The symptoms of panic attacks are intense and overwhelming, often mimicking serious medical conditions. The physical symptoms begin suddenly and peak within minutes. Your heart pounds, pulse races, and breathing becomes rapid and shallow, creating a sensation of suffocation. This rapid breathing can cause tingling or numbness in extremities. Dizziness, trembling, and uncontrollable shaking commonly occur. Many people report chest pain or discomfort, sharp, stabbing, or a sense of tightness, often leading them to believe they're having heart attacks. Sweating increases regardless of temperature, and hot flashes alternate with chills. Stomach distress, nausea, and abdominal discomfort are common. Some experience feeling detached from reality, derealization, or from themselves, depersonalization, which can be particularly frightening. These physical symptoms accompany overwhelming psychological distress. A sense of impending doom takes over, a powerful feeling that something terrible will happen. Many describe intense fear of losing control or going crazy. Perhaps most frightening is the fear of dying, which feels absolutely real in the moment. What makes panic attacks so distressing is how symptoms interact and amplify each other. Your racing heart makes you worry about a heart attack, increasing anxiety, making your heart beat faster. Difficulty breathing feels like suffocation, increasing panic, leading to more rapid breathing. This creates a cascade of escalating symptoms. After an attack subsides, you're often left exhausted. The intense activation of your fight or flight system depletes energy, leaving you physically and emotionally drained. Many report residual anxiety for hours or days afterward, and worry about future attacks becomes common. This fear of fear often transforms isolated attacks into panic disorder, as people avoid situations where attacks might occur. Before we continue, if you have been finding the video helpful so far, hit the like button, and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Causes of panic attacks. The exact causes of panic attacks aren't fully understood, but they likely happen due to a combination of biological, psychological, and environmental factors. Biologically, your body has a natural alarm system designed to protect you from danger. When triggered, it initiates the fight or flight response, which is a surge of hormones that increases heart rate and prepares your body to confront or escape threats. In people prone to panic attacks, this system may be overly sensitive or misfire when no real danger exists. Research suggests that certain brain areas, particularly the amygdala, which processes fear, may function differently in people who experience panic attacks. There appears to be a genetic component as well. If your parents or siblings have panic disorder or other anxiety disorders, you're more likely to develop them yourself, suggesting a hereditary predisposition to anxiety. Your temperament, which are the personality traits you're born with, may also play a role, with people more sensitive to stress being more prone to panic attacks. Major life transitions or stressful events can also trigger first attacks or worsen existing ones. These might include significant changes like marriage, having a baby, or starting a new job. Traumatic events such as accidents, assault, or losing a loved one can also trigger attacks, even years afterward. Chronic stress creates a backdrop of anxiety that makes panic attacks more likely. Other than these causes, certain medical conditions can cause symptoms that mimic or trigger panic attacks. Thyroid problems, heart conditions, low blood sugar, or inner ear disturbances can create physical sensations misinterpreted as danger signals, potentially triggering panic responses. Substance use significantly impacts panic attacks. Stimulants like caffeine can increase anxiety, while alcohol and medication withdrawal can cause panic-like symptoms. Some medications themselves list anxiety as side effects. Cognitive factors contribute significantly. People who catastrophize physical sensations, like interpreting normal bodily feelings as dangerous, may be more panic-prone. Perceiving a slight increase in heart rate as an impending heart attack can trigger anxiety that creates a full-blown panic attack, forming a vicious cycle. Diagnosis of panic attacks. Diagnosing panic attacks involves ruling out other potential medical causes while identifying characteristic symptoms. The process typically begins with a thorough medical examination. This step is crucial because many panic symptoms, racing heart, chest pain, shortness of breath, can resemble serious conditions like heart attacks or thyroid problems. Your doctor will likely perform a physical exam and may order tests like an EKG, blood tests, or lung function assessments. Once medical causes are ruled out, mental health professionals use specific criteria to identify panic attacks and determine if they're part of panic disorder. According to the DSM-5, a panic attack is characterized by a sudden surge of intense fear reaching peak within minutes and including at least 4 characteristic symptoms. For panic disorder diagnosis, you must experience recurrent, unexpected attacks, followed by at least 1 month of concern about more attacks or behavior changes related to them. Treatment for panic attacks. Effective treatments for panic attacks can significantly reduce or eliminate symptoms for most people. Number 1. Cognitive behavioral therapy, CBT. This is the gold standard psychological treatment for panic attacks. It helps you identify and change thought patterns that trigger panic. The cognitive component challenges the wrong misinterpretations of bodily sensations, like thinking a racing heart means you're having a heart attack. The behavioral component often includes exposure therapy, where you safely experience panic-like sensations to learn they aren't dangerous. This interoceptive exposure breaks the fear cycle fueling attacks. CBT typically involves weekly sessions for 12 to 16 weeks with homework between sessions. Studies show 70 to 90% of people experience significant improvement, with benefits lasting after treatment ends. Its effectiveness comes from addressing underlying mechanisms, maintaining panic, not just managing symptoms. Number 2. Medications. Several medications effectively treat panic attacks. Selective serotonin reuptake inhibitors like sertraline and fluoxetine are typically first-line treatments. These antidepressants regulate brain serotonin and reduce attack frequency and intensity. Although they take 2 to 6 weeks to reach full effectiveness, they provide significant relief with manageable side effects. Serotonin norepinephrine reuptake inhibitors work similarly. Benzodiazepines like alprazolam provide rapid relief but carry dependence risks, making them suitable mainly for short-term use. Beta blockers help control physical symptoms like rapid heartbeat, but don't address underlying anxiety. Medication works best combined with therapy and requires medical supervision with regular follow-up appointments. Number 3. Lifestyle modifications. Daily habit changes can significantly reduce vulnerability to attacks. Regular exercise decreases anxiety sensitivity. Even 30 minutes of moderate activity several times weekly helps your body become accustomed to sensations like increased heart rate, making them less frightening. Good sleep hygiene prevents sleep deprivation that increases anxiety. Dietary adjustments, particularly reducing stimulants like caffeine, help manage symptoms. Finally, finding healthy ways to manage daily stressors reduces baseline anxiety, making attacks more likely. Number 4. Mindfulness and relaxation techniques. These approaches develop different relationships with anxiety sensations. Mindfulness meditation teaches observing physical sensations without catastrophizing them, often preventing full attacks from developing. Deep breathing counteracts the shallow, rapid breathing pattern during panic. Progressive muscle relaxation reduces physical tension associated with anxiety. These techniques require regular practice to be effective, ideally daily, even when not anxious. Now, we want to hear from you. Have you ever experienced a panic attack? If so, what did it feel like, and how did you manage to calm yourself down? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.